Good afternoon. My name is Chris Gotti. I work in public affairs at Mayo Clinic. I'm joined today by Dr. Bill Rupp and Bob Brigham, and on your sheets you have their titles if you need those. What we're going to do today is provide an update on what's occurred over the course of the last week since we were last with you, to provide you timely information as we've made progress addressing this situation. Dr. Rupp has some opening remarks, and then he'll be joined by Bob Brigham to respond to questions. And we've got about a half hour for this time. So, Bill?
Last week, we committed to sharing with you timely updates and new information as we have it. Last week, we shared information that we'd learned the day before, that a former employee had admitted to us that he'd stolen pain medication intended for our patients, and in so doing had put our patients at risk. His admission unlocked a key puzzle that we'd been piecing together with the Department of Health, the Florida Department of Health, and the Center for Disease Control and Prevention for about 3.5 years. That same day, we shared the information with the Jacksonville Sheriff's Department, and their comprehensive criminal investigation of the employee's actions is underway. Mayo Clinic is cooperating in every possible way with the Jacksonville Sheriff's Office. We're here today to provide you an update about what's gone on during the last week, what we've learned, what we're doing on behalf of our patients, and what we're doing to ensure this happens again. And I'm going to use some notes because there's a fair amount of activity over the last week. We have focused our energy first in working with the Department of Health and the Center for Disease Control to identify that group of patients that are in that circle of risk. We started by developing a list of every patient that had come through interventional radiology, both at St. Luke's Hospital and Mayo Clinic Hospital, since the employee was hired in 2004. Then we were able to narrow the list to those patients who were seen on a day the employee was working, and then further narrow it to those patients who received injectable pain medicines. That number is 3,209. Tomorrow, we will begin our direct communication with those patients who we believe should be tested to see if they have any evidence of exposure to hepatitis C. We're putting in place what's needed to support our patients during this very difficult time for them. No one wants to hear the news that we are going to share with them, that this individual's criminal behavior put them at risk. Mayo Clinic will do whatever is necessary to support the needs of our patients. First, we will be notifying them by letter. There is a regular mail letter going and a certified letter going to the patients. Those letters will include a fact sheet on how to get tested and information about hepatitis C. There will be a hotline for general questions. That number is 877-956-1768, and it is manned from 7 a.m. to 10 p.m. There will be 3 testing options available for patients. First, the patients can make an appointment here at Mayo Clinic to have a blood sample drawn for testing here at Mayo. The second option is to arrange for a licensed phlebotomist, somebody who draws blood, to see the patient in their home, gather the sample, and bring it here for testing at Mayo Clinic. For those patients who prefer to have their blood tested elsewhere, Guardian Medical Logistics will collect the sample and send it to Quest Laboratories, which is another major laboratory testing company. Mayo will promptly contact all patients with the test results and any recommendations for additional evaluation. We will be calling patients who don't respond to the letters. As a further precaution, and again in conjunction with the CDC and the Department of Health, this is fairly standard in these instances, we'll be asking the patients to let us test them for HIV and hepatitis B. It is of note that the former employee was tested this week again and was not found to have hepatitis B or HIV. We're working to make sure this doesn't happen again. We're thoroughly examining the multiple different systems we have in place to control narcotics in order to create an even tighter monitoring system. We regularly retrain our staff in precautions to reduce the likelihood of transmission from gowns, gloves, masks, goggles, etc., and other devices. And we're responding in concert with our employees and our own staff to be extra vigilant for outliers within the walls of Mayo. In other words, to be alert, to speak up, and to report anything that looks unusual. Some have asked, why did it take you so long to report this and make it public? You've been given a diagram that I'll refer to here. The issue is that hepatitis C exists. According to the CDC, there is no average rate for hepatitis, since most healthcare-associated cases of hepatitis C go unrecognized. In general, in healthcare, the harder we look, the more we find. Case in point is that our transplant program does very aggressive active surveillance in the form of periodic screening of these patients looking for the disease. That's how we found these cases. Investigators at Mayo Clinic, the Center for Disease Control, and the Florida Department of Health have worked tirelessly for 3.5 years to find the source of this hepatitis C transmission within Mayo Clinic. These cases each emerged about 1 year apart. The first was in 2007. We brought the Florida Department of Health and the CDC here on campus to try to help us identify the source. In working with them, we did a complete investigation and couldn't find any evidence to support our theory that this might be patient-to-patient transmission, for example, from blood glucose testing monitors. We looked very hard for that, but couldn't find any evidence that that was the case. So we moved to the next theory and did a complete investigation, assuming a provider-to-patient transmission as a result of not following proper control precautions. That investigation was completed and yielded no source. In December 2009, after sophisticated genetic testing showed the third patient's viral strain matched the other two cases, we altered our theory and worked our investigation under the assumption that there was possible tampering and the infection control precautions were broken through drug diversion. That third case helped Mayo Clinic, the CDC, and Florida Department of Health identify a pattern. After we were able to genetically link the cases, the investigation was completed within 6 months. During that 6-month period, we analyzed literally tens of thousands of pieces of data from medical records and patient schedules to narrow the area of concern to interventional radiology. All 22 employees that could have possibly been involved in any way in interventional radiology were tested for hepatitis C, and 1 was positive. CDC genetic testing showed that technologist's virus was similar to the strain of the other 3 patients, and that employee was immediately removed from the workplace. He then later admitted to stealing the drugs. This has been a puzzle, a very, very challenging puzzle, and it's taken time to piece it together. I'm confident in saying that working closely with CDC and the Florida Department of Health, we did everything possible to unlock it. The next phase will also take time. We would all like answers within minutes. Unfortunately, it's likely to be days and weeks to get the testing done. A last comment. I've always been proud to work for Mayo Clinic. I'm even prouder today. The response from our staff has been overwhelming. At first, they were heartbroken. But our staff has a tremendous commitment to our patients and to Mayo Clinic. We will get our patients through this, and Mayo will get through this. Finally, most gratifying has been the response of our patients. We have had many, many calls and contacts from patients expressing their support and their continued trust.